power. He's the king of action and contraction in your muscles, but now he's kind of like a dictator. Today we're wrapping up hyperkalemia. Hyper meaning high, kal meaning potassium, emia in the blood, so potassium over 5.0 in the blood. Now, potassium's main function is to maintain heart and muscle contraction through keeping each muscle cell charged or polarized via this sodium-potassium pump. Now, potassium's regulated by kidneys, which I call the washing machines of the body, because they filter the blood and get rid of excess substances, and in this case, potassium. Potassium's influenced by aldosterone hormone I call aldosterone, the security bouncer to the most exclusive nightclub in your body, Club RAS, the renin-angiotensin-aldosterone system in the kidneys. It's a super funny story I covered in our full course here at simplenursing.com. Main causes that keep high potassium in the body and not in the body. So M stands for medications like ACE inhibitors, drugs that end in pril for hypertension or high blood pressure patients. Spironolactone is our potassium-sparing diuretic that keeps potassium in the body. And NSAIDs like ibuprofen are non-steroidal anti-inflammatory drugs, increase potassium or basically keep it in the body. Acidosis causes a disruption in potassium balance, mainly because sodium-potassium pump, which keeps our acid and base in balance, is being overworked. Cellular destruction like burns or trauma. Now, when cells burst, called lysis, potassium inside that cell explodes into the bloodstream, increasing potassium in the blood. Hypoaldosteronism, usually seen in Addison's disease, causes a low aldosterone hormone, resulting in high potassium in the body. Increase of potassium intake, usually from IV solutions or medications, not really caused by diet unless the patient is renally impaired. Brings to our next point, nephrons that are broken, kidney failure patients, also called renally impaired or those on dialysis. Their kidney washing machines are broken, so they can't wash out or excrete that potassium out of the body. Lastly, excretion problems, as mentioned before, mostly dialysis patients. So guys, please remember, renally impaired patients usually have chronically hyperkalemia, or basically high potassium in the body. What's going on in hyperkalemia? Well, high potassium, right? And since potassium is the king of action and contraction in your muscles, well then too much potassium, everything in the body is going to be really tight and contracted. So the heart is going to be tight and contracted. You'll see vital signs like irregular heartbeat from all that action and contraction, low blood pressure known as hypotension, low heart rate known as bradycardia. The EKG is going to have ST elevations and peak T waves, which is a big NCLEX tip, by the way. The ventricles are basically cramping up. They're tight and contracted. They're not resting. They're not relaxing. They're not repolarizing. They're basically not releasing. Now, VFib and cardiac standstill can occur with extremely high potassium. So VFib and cardiac standstill are very serious EKG dysrhythmias. Huge, severe sign. So big NCLEX tip. The respiratory system will be tight and contracted, so a tight diaphragm muscle might lead to respiratory failure. The GI tract will have action and contraction, so increased motility, hyperactive vowel sounds, and diarrhea. Basically, the GI tract is squeezing and flexing the poop right out of you because the body is trying to get rid of all that extra potassium. Now, neurologically in your brain and spinal cords, there'll be too much strain on the brain, tight and contracted, so your patient's going to be confused. Neuromuscularly, tight and contracted, so profound weakness or a general feeling of heaviness, cramping, increased DTRs, deep tendon reflexes, paralysis in the extremities because the body's just too tight and contracted, tingling, burning, and numbness around the hands, feet, and mouth. Now, a little NCLEX tip for you. Words like profound and severe are late and serious signs. They indicate a priority patient. So assess these patients first. Okay, now that we know what's wrong, what are we going to do about it? Nursing interventions for high potassium. Remember our nifty acronym MD-KID? Well, the M stands for monitor the EKG. So ST elevations and peak T waves, which is a huge NCLEX tip. D stands for diet, so no salt substitutes, no fruits, no green leafy vegetables, all contain high potassium. K-exolate helps K exit the body, that's why some call it K-exolate. Now this is the brand name and trade name, but for the NCLEX, the generic name is sodium polystyrene sulfonate. Little NCLEX tip for you is that the NCLEX is only using generic names for drugs, so no more brand names or trade names. But caution, you'll have very explosive diarrhea very shortly after administration, so be prepared and have a bedside commode ready. Probably best to give before shift change, huh? Am I right, fellas? I is for IV sodium bicarb, which corrects the acidosis. IV calcium gluconate helps decrease that muscular irritability. So remember calcium gluconate, calcium glues down the muscles to make them less twitchy. Calcium gluconate, get it? Insulin opens up the cells and potassium sneaks inside, causing low potassium in the bloodstream. Albuterol, our beta-2 agonist, usually given to asthmatic patients, can also push potassium into the cell, kind of like a forced potassium pump. Lastly, diuretics and dialysis, like furosemide, are loop diuretics, and hydrochlorothiazide are thiazide diuretics. These are potassium-wasting diuretics. Now, if your patient has broken kidneys and can't pee out all that potassium, then we use the backup kidney, the dialysis machine, to wash the blood and get that high potassium out of the body and into the body. So that wraps up our hyperkalemia, guys. Now, for full access to our complete course on electrolytes with over